I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and recently I made a video explaining what focal asymmetry means, and someone asked me if it's the same thing as non-mass enhancement on an MRI. And the answer is no, but sometimes an area with focal asymmetry on a mammogram might also have non-mass enhancement on an MRI. So what is non-mass enhancement? This is an example. You can see that the white area, which the arrow is denoting, doesn't really look like a mass, but looks like a skinny white line that stands out against the background breast tissue. This is another example of non-mass enhancement, and what this is showing is enhancement in a duct or demonstrating ductal carcinoma in situ. Here's another example of non-mass enhancement. You can see that there is not a distinct lump, but a big part of this patient's breast is lighting up compared to the other side. Non-mass enhancement is often associated with ductal carcinoma in situ, which is what the first two cases were, or lobular breast cancer, which is what this one is. In contrast, this is what mass enhancement looks like on a breast MRI. And you can see there is a distinct lump here and not just clumps of white areas or lines of white areas on this MRI. If you have non-mass enhancement on a breast MRI, the radiologist is probably going to recommend a biopsy, but it doesn't always mean that it's going to end up being ductal carcinoma in situ or a lobular breast cancer. There are also benign things like fibrocystic changes in the breast that can result in non-mass enhancement. And here's an example of what that looks like as well.